Hello, good evening, everyone. It is 6 p.m. and it is time for some quiz that is must know MCQs. So these are the set of MCQs that we have handpicked for you so that you are thoroughly prepared for your NEET PG. So this is must know MCQs because these contains a mixed bag of variety of things. It is from osteology, histology, gross anatomy, general anatomy, and a lot of clinical as well. It is mixed. That's why these are something that you must know, and it is in the MCQ form, and a lot of radiology questions are also present in this. And I welcome you all for this session of must know MCQs. And then there is one more at 9:30. This is at 6 p.m. There is another one at 9:30 p.m. So these two, I'm going to have it as a MCQ based just for this month. That is MCQ based on YouTube. Next month, that is in June, you have a slight change in the time. That is 7 p.m. will be the first session. That is going to be a topic that I'm going to discuss. It is again going to be loaded with a lot of clinical aspects. So we are going to discuss the clinical aspects. What I have observed is a lot of students who have not much clinical background try to attempt these MCQs, and it becomes very difficult when they don't understand, and from the scratch they don't understand, so they just try to guess. They do a lot of guesswork, and that is not going to help you at all, to be very frank. So guessworks don't work here because there is this negative marking, and that is definitely going to put you down with the ranking. So it is always take the advice, don't do guesswork, go for the topic reading first and then attempt the MCQs. So I have topic based, clinical aspect based discussion that is at 7 p.m. every single day in the month of June. And then again, I have a MCQ that is at 10 p.m. So this 10 p.m. will have MCQs that is again going to be random. It is not going to be topic based because it will get monotonous. So it is going to be a random one, and this random one will cover most of the questions that you must know. So this is again 10 p.m. one, that is both on the YouTube. So both of these are again free. So it is easy for you to access and also to make a decision on whether you are prepared or it's the right time for you to go for your plus subscription. Okay. So now you have negative marking. So you have to be very careful with what answers you pick. So all these mock tests which should give you a kind of practice, just like or the feel of what you have to go through during your actual exams. So it's very important that you take every single session like a serious one and then attempt the MCQs. So that's why we have this 7 o'clock one, which is topic based, and then you have another one at 10 p.m. So both of this will be from the month of June, another 2 days to go. So today you have this Saturday, then tomorrow is Sunday and Monday. These 2 days we are going to stick with the same time, but from June, that is from Tuesday onwards, the timings are going to be little different for both of us. So, okay, so now here me. Okay, Dr. Rohini. Just see if there are any questions regarding the timings and things like that. Okay. So this is fine with everyone, I guess. This is me, Dr. Rohini. talking to you, and then we are going to start the MCQs in a bit. But before that, let me just give you a just quick glimpse about what I do. I have about 10 to 15 years of experience teaching in India and abroad, and I also teach a lot of students from various streams like the MCI, PLAB, USMLE, and all these students who are the aspirants of PG seat, and NEET PG students also approach me, and then all this is because of the exposure that I have for so many years in India and abroad. You can bank on me, you can follow me at Aqua. I have a link as well posted, so please go through that link, and you can hit a like, you can subscribe to get notifications about all my upcoming classes. I also have special classes. So special classes are at 8 a.m. every morning. So 8 a.m. classes are very important, because here also we are going to have a topic discussion, and then again there is a class at 10:40, and this is going to be purely for this next 2 days, that is for Sunday and Monday. Then the timings would again change, that is from the month of June. So till then, for 2 days, please stick to this, that is tomorrow and day after. All right. So we'll move to the next slide. So this is a very important slide where you can see that the unacademy.com website, if you go, you can find me with this name, username at RoAqua. So this is my username, RoAqua. And if you subscribe, that is for plus classes on YouTube, you have to use this code. So promo codes are very important, because we want you to be benefited, not just with your education and the coaching, but also with your pocket. So it is a discount that you can avail by using this code ROHINI for your YouTube subscriptions, and you can also unlock this code ROHINI 10 for your special classes. So this, if you have been using special classes, this is the code you can use, and then you can avail discount for all your subscribed classes. Okay, so now we'll go with the first question. All right, now let's see what are the questions we have, and if there are anyone who are not understanding what I'm saying, and if they have any queries or questions, let me just address that before we move on to the questions. So we have okay, first question says, the patient relates that she stays physically fit. She says that she is physically very fit and running, that means she is active. Playing hockey, oh, she is physically really fit. And then she is a local semi-professional women's team participant. And then recently she participated in most local charity runs as well. So all this she has been doing. That means she is passionate about running. Okay. Of late, what happened to her? Presently, she is complaining that her training and participation has reduced drastically. She believes that the muscles of her right lower limb, okay, the right lower limb. So she's talking about lower limb are weaker than those of the left. So she's not exactly saying where. She's not mentioning where, whether it is in the thigh region or in the leg region. She's not mentioning, because usually the patients don't give so much information. It is for us to figure it out. So this is what exactly her complaint is. the muscles of a right lower limb. So it is the lower limb is weaker than those of the left when she compares. So what could be the problem? What could be wrong with this? So clinical problems to consider here would be, one is hamstrings. Sometimes the hamstrings, they undergo this tendinitis, inflammation of the tendon, because these lower limb muscles, they have a common tendinous insertion. So they have all these, Achilles tendon has a common tendinous insertion, that is because of the gastrocnemius muscle. And also all these hamstrings, they have the insertions on the back side of the knee, that is the popliteal fossa boundary it forms. And they also have the tendinous insertion, which is very conspicuous, and there is this joint, knee joint, which has a lot of movement, and so the tendinitis or inflammation of the tendon could happen, and this is known as hamstring tendinitis. So that is one thing to consider. The other one is herniated lumbar disc could be the problem for her pain. Okay, so she may not be exactly mentioning where exactly is the pain. So it also depends on the herniated disc. If it is interfering with the roots, because you know that there is a lumbar plexus, there is sacral plexus. If it is interfering with the roots that form the plexus, then there are high chances that could be because of that. That is one thing. And then there is this Piriformis syndrome, which is usually ignored. Piriformis syndrome. So you have to find out whether you can ask her to do the lateral rotation. So if she complains that she is not able to do efficiently lateral rotation of the hip, then this could be the culprit, the Piriformis syndrome. Let's see what is the answer. So now, how many of you think it is hamstring tendinitis? How many of you think it is intervertebral disc? And how many of you think it could be because of the IV disc? Which one do you think? Which one do you think? Piriformis syndrome, herniated disc. Okay, we have a lot of people watching, and anyone who wants to attempt this. I feel it is the Piriformis syndrome because she is mentioning about the muscle that, the right side and the left side, the muscles. Now, clinical problems that you can consider is they look different because of the inactivity. So the muscles sometimes shrink in size because of underuse. So that could be one of the reasons. Let's see what is that explanation you can talk about is Piriformis syndrome. Okay, so this is the answer, Piriformis syndrome. So Piriformis syndrome, actually piriformis, more than the piriformis being the, culprit, it is the sciatic nerve that gets compressed in the sciatic notch. So now here what happens is there is a greater sciatic notch and a lesser sciatic notch. The greater sciatic notch is divided by this piriformis muscle. Sometimes there is this inflammation of the tendon of these muscles which are very close to the joint, and the piriformis muscle can pinch the nerve that is beneath it. So now this piriformis actually divides this greater sciatic notch into upper and lower compartment. There are structures passing through lower, there are structures passing through upper, like the superior gluteal passing through upper, the inferior gluteal is passing through lower, and also sciatic is in the lower. Sciatic is present in the lower compartment, that is dividing the greater sciatic notch into upper and lower. this piriformis muscle, and see where it is attached. It is attached to the greater trochanter. This is the greater trochanter. So piriformis is one of the lateral rotators. So when these muscles, they get inflamed, they can also press upon the structures that is beneath it, that is sciatic nerve. So you can see that the sciatic nerve passes beneath this piriformis and it supplies the muscles in the region that is behind the leg, behind the thigh region. So these muscles are called hamstrings. So hamstrings are supplied by the sciatic nerve, but these muscles are quadriceps in front. They are supplied by femoral nerve. Then this sciatic nerve comes down and it divides into two. So it is got two branches. One is common peroneal, the other one is tibial. So now when the sciatic nerve is compressed, it not only sends pain radiating on the back side of the thigh, back side of the leg, up to the underside of the sole of the foot as well, because it is supplied by the same tibial nerve, the continuation of the sciatic. So now here what happens is, because the piriformis presses upon this, the muscles that are supplied by the sciatic nerve will also undergo atrophy. So because of atrophy of the muscles, this happens. So all this together, it is known as Piriformis Syndrome. So the person will also not be able to run like before, walk like before. He will face problem with the lateral rotation of the hip. That is the answer. So these are the muscles which are in the list of lateral rotators. You have 6 muscles altogether. You can list 6 muscles. You have piriformis, which is called the key muscle. This is the key muscle. So you can call this as the prime mover. Prime mover is the one which, brings about movement. So prime mover is piriformis. Next, you have gamellae. There is a superior gamellae, inferior gamellae, and then there is also obturators, obturator externus and internus. You can see the obturators, 2 externus and internus, both of them. And you also have quadratus femoris. So altogether 1, 2, 3, 4, 5, 6. So these 6 muscles are known as lateral rotators of the hip joint. It's a very important action. It's a very important action. Lateral rotation of the hip joint is a very important action. Okay, so now here, okay, next question, we'll move on to the next question. Let's see what is the question. The question says, identify the nerve. Do you identify the nerve? What is the nerve? Which nerve do you identify? So there are a lot of nerves that is emerging. It is from the root value L4 to S3. You have the sciatic, you have the L4, L5, all these root values S1, S2, S3. So this will give rise to the sciatic nerve. So that is the root value of the sciatic nerve. So sciatic nerve, you can see it passes behind the piriformis. So how it runs through the back side of the thigh, you can see, and it goes down. So let's see what is the answer. So this is sciatic nerve. Sciatic nerve is passing in the lower compartment of the greater sciatic notch. So this lower compartment has this greater sciatic notch, giving the lower compartment and upper compartment. I told you lower compartment along with which nerve it passes is important. Sciatic along with the inferior gluteal nerve. So you can see that it crosses all these, and it also crosses between the biceps femoris long head. This is a very important question in the NEET PG. So it is secured under the long head of biceps femoris. What are the hamstrings? Name the hamstrings. If you know the hamstrings name, you will be able to relate. So you have biceps femoris. You have semitendinosus, semimembranosus. So these are the three muscles that you can see in the back side of the thigh. They are called hamstrings. They are supplied by the sciatic nerve. And you can see that how nicely it is secured behind the biceps femoris long head. Okay, this is one important question for your NEET PG. Okay. Next one. So the root value for the sciatic is L4 to S3. This is the lumbosacral trunk plexus. So here, next question we move to. The next question says, identify the condition. Now, you have to look at the picture and say, what condition do you think this is? It's an X-ray of which region is this? You can see the femur. You can also see the medial and the lateral condyle of the. See, this is anteriorly how it is displaced from its position. Which bone is displaced? You can see that the patella is displaced from its position. So this is displaced patella. The patella is held by ligament. You have all these quadriceps coming to the patella. So quadriceps, they form a common tendon and they are attached to the patella. So it, in a way, it secures the patella in place. In a way, it secures the patella in place. But what happens is, since the medial side is bigger, and there is this lateral side and the medial side, there are facets on the lateral and the medial side on the back side of the patella. So it is actually articulating with the femur bone, and it forms a joint, and it is a part of the knee joint. It is called patellofemoral joint. Patellofemoral joint is nothing but it is a plain joint because you don't see any movement other than the sliding and gliding type. So you call this as a plain joint. So you remember P for the patella, it's a plain joint. Okay. Yes. Okay, Nilusha says it is knee joint, and Rishabh says hello. And you can see that there is displacement of the patella. But which side is more common is a question. Which side is more common? Is it the medial side displacement more common or the lateral side displacement more common? Which one is more common in case of displacement of the patella or dislocation of the patella? Where does it move? It moves medially or laterally. And you must remember the quadriceps which are present. Quadriceps, if we have to list, we have vastus, medialis, vastus, lateralis, and we have intermedius. Okay, all these are the vastus muscles. And along with that, we have one more muscle that is known as rectus femoris. This is obviously on the medial side. This is obviously on the lateral side. So which muscle is weaker? Yes, Nilusha says lateral displacement. Lateral displacement is more common. Why do you think lateral displacement is more common? You're right. But why? Which muscle do you think is weak? Which one is weaker? Intermedius cannot be because it is in the center. So which one do you think? If you are falling on this side, somebody should be pulling you from the opposite side so that you can come back to the center, right? So which one is on the opposite side? So the one which is on the opposite side is the vastus medialis. So the one which should be strong is vastus medialis. Okay, so because of the fibers of vastus medialis are weaker, or the tendon that forms on the attachment, common tendon that forms, that is called quadriceps tendon, is weaker, the patella can get displaced laterally. So lateral displacement is more common compared to any other displacement. I hope you have understood. You can see always the medial one is bigger compared to the lateral side. The lateral side is not small. The medial side is the bigger articular face. Okay. Next. So now this gives you little more information. Now, patellofemoral joint we talked about, and it consists of the patella and the trochlear surface of the tibia. So now femoral condyles you can see, and the tibia also you can see. Now you can see that the articular cartilage of medial facet is thicker, like I showed you. The lateral one is on the lateral side. The facet on the lateral side is bigger. Now it has an anterior projection on the lateral femoral condyle as well. So now here the main thing that we are looking at is the patellofemoral articulation that we are talking about. It depends on the function of the quadriceps, how strong the quadriceps muscle is functioning, or what is the angle at which the patella bone is held in place. All this will help in knee movement. So now usually the patellofemoral dislocation happens when knee is extended. Now, which group of muscle does the knee extension? Now, who can tell me which group does the knee extension? Always the action of knee is opposite to the action of hip. So if the knee is doing extension, which group of muscles would be doing that extension? Hip would be doing the flexion. Same group of muscles will be doing the flexion. So now here knee is extended by quadriceps. So when they are in complete action, that is when there is a chance that the patella can get dislocated. So especially when it is not when it is resting, but when it is in action, the patella can get dislocated. And whenever there is a knee extension, the opposite thing is happening with the hip, that is flexion. If the same muscles are working, then it would be doing flexion at the hip joint. So you must remember this. So this is how it looks. You can see that the patella is moving laterally. There is collateral ligaments on either side. There is a medial collateral ligament. There is a lateral collateral ligament. There is a medial and a lateral collateral ligament. And there is also this patellar ligament. Okay. So now you can see the tendon, how it gets inserted onto the patella. Medial collateral ligament is attached and the lateral one is free. So whenever there is a menisci that is injured, there are high chances that the medial collateral ligament also will be damaged. So that is one thing to remember. Okay, next one. Okay, we have some dislocations and other things that we talked about. You should know how much it accounts for. The patellar dislocation accounts for about 3% of the knee injuries. And you should also remember that there is a groove that is present on the lateral side. Lateral facet has a groove. So that tries to keep it in place. Okay, so now this one can get dislocated in football injuries, rugby, ice hockey. All these are some of the scenarios they can give you. So all these kind of sports which involves running and extension of knee. There is no flexion, there is only extension most of the time. In such sports, there is sudden jerky movement or twisting or forceful action that could happen that can result in the dislocation of the patella. Okay, next we'll go to the other question. Okay. Now, if you are connecting with these questions and if you feel, yes, I'm able to answer, and if you're happy about this, I would suggest you please go and hit a like first, and also follow me at ROHAQUA. I have sent you the link, and also you know that through Unacademy platform, you can go to the educator, you type ROHAQUA and follow me in my profile. So when you follow me, we get motivated to do such, good clinical based MCQs. So now here, compared to these two things, now there is this lot of things that is happening. This side of the muscle is not there at all. Do you see? What do you think is wrong? What do you think is wrong? Anybody? That is why this lady is, the hand is pointing at this region. There should be which muscles, and look at the amount of muscles. There is decrease in the muscle mass. What has happened? What is the condition? That is quadriceps muscle wasting. So there is lot of muscle wasting. So there could be atrophic changes that leads to decrease in the muscle mass. It could be because of the clinical based, some diseases of the limb, or it could be purely because of immobilization. So it is also known as disuse atrophy. So what happens is many times they experience pain when they use their limbs after a long time of sitting. The weather also plays a role, and this can result in reflex inhibition of the quadriceps. So quadriceps do not work very well and they decrease in their muscle mass, and that's why this reason quadriceps muscle wasting, and the picture depicts the same. Next one, we'll move to the next one. Now in this one, what do you identify? Do you identify something? What do you identify? There is a small, teardrop like structure that is what you can see. Do you see the teardrop sign? You see the teardrop sign, and it has gone into this sinus, that is maxillary 8 sinus. And this is because of the fracture. Otherwise, why the content would just come down? So this is because of the fracture. It could be blowout fracture. It could be the blowout fracture of which one? orbital rim. Inferior border of the orbit. So you can see the bony orbit has this inferior border, which should be like this, and that is gone. Instead of that, you can see that the content has just seeped down into the maxillary air sinus. So let's see blowout fracture. Yes, you're right. And that is exactly what we are talking about, blowout fracture. So there is partial herniation of the orbital contents through this wall. Which wall? Through the inferior wall. So it could be because of blunt force that is applied on the eye, or it could be because of the weakest bone that is present. Inferior and the medial wall is very weak comparatively. Medial is also very weak. Medial is the weakest wall. The inferior is also weak because of the presence of orbital plates. So this is what happens. Battleground says, good evening, how are you? Hi, good evening, how are you? And then we have, yes, you should give NEET UG this time. NEET UG, okay. All right. So it is not PG, it is UG you're talking about. Okay. So you are ahead of everyone because you are planning to study for PG now, and you are trying to get some information from PG. Always knowledge is not limited to any one person. So, or into any one particular stream. So knowledge is something that is that should be accessible to everyone. So you are most welcome, and see how much you can understand. If you are at NEET PG, then it would have been fine. But if you are at UG, see how much you can understand these things. Okay. But it is definitely interesting. Biology and medical subjects are very interesting subjects compared to anything else, right? Okay. Now we were talking about blowout fracture, orbital rim fracture you can see, and then you can see that the maxilla, zygomatic, frontal, all these bones are involved in the inferior wall. So that is what has happened. Okay, next one. What is this? Anybody? Anyone who can identify what is this? Nilusha, do you know what is this? Battlecore? Mastoid. It is a mastoid process? Yes. So which nerve is present here? This will be here, seventh cranial nerve. And yes, and you can also see the ear is pushed forward. Right? Ear is pushed forward because of the collection of pus. Yes. Ajinkya, correct. So now middle ear infections are known as otitis media. Now here the pus or the infection can spread from the air, from that region, from the ear region into the mastoid air cells. And because it is porous, it can get easily infected, and it is a perfect region for the replication of the pathogens. They can multiply and breed quickly. And if it gets infected, then it can also spread to the brain and also cause meningitis. So that is again secondary to the infection of mastoiditis. So first otitis media to mastoiditis, that to meningitis. So this is one thing you have to remember. So 1 step, 2 step, 3 step. I think by the time they would realize that something is wrong. But if the person is that ignorant, then it could also lead to this condition, meningitis. So you should be very careful about the facial nerve when this mastoid process is drained. That is the only way you can drain the mastoid process. So facial nerve has to be carefully protected. And how do you protect? How do you do that? What should be your approach? How do you approach? There is a small triangular area. What is the triangular area known as? Anybody in the group knows what is the triangular area called? Anyone knows what is the triangular area known as? Anybody waiting for the answer? Okay, Ajinkya, anybody? That is called supramiatal triangle. Supramiatal triangle. Okay, it is about 0.7 millimeters in depth. You can pass the needle and you can aspirate the content from the mastoid process. And care should be taken not to damage the facial nerve. And supramiatal triangle you can identify by if this is the mastoid process, if this is your mastoid process, and then this is the the plate. Then there is this small area that from the posterior margin you can put a tangent. And this is the supramiatal crest, and then you join this, you get this triangle. This is a triangle. This is the mastoid process. So this triangle is known as the supramiatal triangle, and it's a small region just above the mastoid process. So if you pass the needle here, you will be able to reach the air cells where you can drain the mastoid process. So this is how it looks, and this is how it looks in the scan. So CT scan will reveal the simple arrows you can see, and you can see the double arrows where there is collection. Okay, so this is the mastoid process. You can see the air cells. That's why you can see that all these porous looking. See, it is haziness is there on this side. There is haziness in the CT scan, and in this one, it's not. This is normal. But this one you see, there is a lot of haziness, and that indicates that it is filled with pus. Okay. So now you can also see the ear that is turned forwards, because this mastoid air cells, which is filled with pus, has been pushing the ear forward. So the only process by which it could be drained is mastoidectomy. So you must remember all these things. And yes, Ajinkya was messaging something. He wanted to mention something else. Is there anything else you wanted to say? Next. Okay, there is a small note on what we can do. We can help you with certain things. That is, one is we can help you achieve your goals. How we can help you? So now we can help you with various things. One is by guiding you to reach your goal. We have all these, MCQs and a lot of free material that is present. So you please explore the app. You go to the app and look for all those free stuff that is available with the app. So once you know there is n number of apps and n number of MCQs and quiz based questions that is present, you can try to answer those questions and see exactly where you stand. So of course the explanations will not be there. For explanations you will have to depend on the educator. So that is one way of keeping your spirits high, by interacting. So you please visit Unacademy website. You can also download the app that is from the Play Store, and then you can start your journey towards your goal. That is one thing. And you have n number of free videos, you have motivational things that is there. And even tomorrow morning at 11 a.m. I have a session where I'm going to talk to you about how to keep yourself motivated with your morning mantra. So this will give you a boost for you to start your day in a good manner. So this is morning mantra at 11 a.m. on Sunday. You can watch me live. So we also have a lot of classes throughout the weekends. We have so many YT festivals, and a lot of classes are there. A lot of free stuff is there. You can watch these YouTube free videos on various topics. So we have sessions that is already scheduled. I have my session every day at 6 p.m. with some MCQs, and then I also have one at 9:30 p.m. It is again the rapid quiz. These quizzes will actually, give you motivation. But sometimes it can also make you a little sad if you are not thorough in your subject. So if you are not confident, or if you're underconfident, or just starting your journey, then I would suggest you to watch my special classes. These special classes are held at 10:40 p.m. and then in the mornings it is at 8 a.m. So 8 a.m. and 10:40 I have my special classes where you can watch topic based interaction. But this is only for this month, that is in the month of May. But from June, there is a slight change. Okay, June, there is a slight change. I'm going to have a session at 8 a.m. as usual. That is going to be the special class. And then I have another one at 7 p.m. and another YouTube at 10 p.m. So these things are going to be different. One is going to be quiz. The other one is going to be a topic. Special class will also be a topic-based one. So this things itself, these topics itself will include the MCQs and also scenario questions with the topic that we are discussing. So many times you find it very difficult to connect the basics with the scenario and then the MCQs. So what we are trying different modes for different audience, because we have variety of audience. We have some of them who are quick learners, some of them are little slow learners. So we have to target everyone. So what we do is we try to adjust our timings and try various methods. Which one is better for you, you can pick that. So I have this 8 a.m. special class, which will give you a topic, and it will also give you some MCQs and scenario based questions to take home at the end of the day. At the end of the hour, that is 8 to 9 a.m., you'll feel that you have achieved something. You have understood the basic. You are also working on the MCQs and you are getting it right. So that is important. Next, you have the 7 p.m. one, that is also topic based one. So topic based one, here it is going to be a case study or some blood supply or nerve supply, which is definitely going to make you think, and you'll feel that you have understood something that is very important, which you can implement in your various MCQs. So you can use this knowledge, the topic based knowledge, when you are working on some MCQs. You can try to recall them, because I'll be giving you a lot of mnemonics to recall the things. So that is 7 p.m. class. And then again 10 p.m. just before you wind up, I have a quiz just to check if you can recall anything. That is going to be a mixed bag. So there is no one particular topic that is targeted because I don't want to keep it monotonous and I want to keep it covering all the things that you can think of. So that is going to be a mixed bag. So with all these, that is 8 a.m., special class, 7 p.m. and 10 p.m., you want to access all this? Follow me. That is Dr. Rohini Mayan. And then you can also use the code ROHINI for the YouTube classes. And then you can use ROHINI 10 for my special classes. When you use these codes, promo codes and unlock, you will get a good discount of 10% and above you can avail for your subscriptions. So try this and follow me so that you get notifications for each class and none of the topics you would want to miss because everything is going to be really, really interesting with a lot of clinical cases discussed. Okay, so now we'll move to the videos and quiz and everything. That the method, the curriculum is going to be completely different because we don't want to block an hour for all the subjects because the audience are the same. Since the audience are you who are going to watch this and get something out of it, we just want to spread it out throughout the day so that you can get maximum benefit. If someone is doing in the morning, the other class would be in the afternoon or later in the evening. So that way you can watch at your convenience. And if you miss out on something, of course, you have recorded ones as well. So your watch time is what is important. And you please watch this so that you get benefited. And for our efforts, we get the acknowledgement. Okay. Is there any other question that we want to? Ajinkya, that is the thing, because everyone will have a different curriculum. You can please go to Unacademy website. You can look at the various educators, what they have posted. And my anatomy, you can access with the promo code. You can access to all my videos, whatever I have posted so far, the topic based ones, MCQ based ones, everything you can see with Dr. Rohini as the search name. Okay, so this is one thing, and then you can download this app. First of all, you go to Unacademy, and then search for the Learners app, that is Unacademy Learning app, and then you download it and you go to NEET PG. There is a list of things that you can look at. You can see what are the various programs we have for you. Here at this, you have a lot of MCQ based questions and many things. When you are not watching a video, when you are not into anything that is, interactive, you can just be on your own, working on the MCQs, or you can just read up something that is put up. All this you can do. All right. So that is one note. And we always suggest you to take this, subscription, PG preparation, because this is very important and it will give you 100% coverage on what you want. So your goal is to, go there or reach there with 100% effort. When you are giving your 100% effort, why not try all these offers and limited time offers these are that is given to you by Unacademy platform. So you have 12 months subscription today. If you have a lot of time till your exam, you can take 12 months subscription and then immediately you get 2 months subscription free within 30 days of the 12 months activity. So 30 days, within the 30 days, you can get the free 2 months activated. So this is possible and it is going to save you money, and also you will get the benefit of extra 2 months subscription, and you will get to do a lot of revisions with the extra 2 months. So please use the code, that is ROHINI and ROHINI 10. So use this code. So you are benefited, we are benefited. That 10% is a good amount to get as a discount. Okay, so now this, you can use all this, and then you can bank on the 100% coverage of your curriculum. So you have a lot of questions from various streams. You can see the demo with the YT YouTube classes. You have seen the demo with the special classes. All this must have already told you what kind of method we use and how much effort is put in. This is just a demo. You must remember, it is not 100%, and it is not 100% structured, because these are all free classes. Just with the free classes, it is difficult to cover 100%. So you should always go for the subscription, that is plus subscription. Once the effort is 100% from your side, you are very close to your goal. So this is an important note. So you want to reach your goal, your effort should be 100%. You can do this with the 100% covering curriculum, that is plus subscription. So try this. And is there any questions that you want to ask other than what we were talking about? Now here we have next question. We can cover one more question. This is a test for which muscle? Now, which muscle do you think is tested with this? Anybody? Now, there is this positive Trendelenburg sign that you can see on the left side here. So, which muscle is the question? So, what muscles are present in this region? You have gluteal muscles, right? Gluteus maximus, gluteus medius, minimus. All these are present, and this is a test for which muscle? Is it for maximus? Is it for these two? Okay. Now this one indicates that the superior gluteal nerve is damaged. If it's a positive sign, it indicates that it is damaged. So which muscle is supplied by superior gluteal? Superior gluteal supplies the medius and the minimus, because it passes through the gap between these two. According to anatomy, any nerve passing between the muscles has to supply the muscles. So you have this. So Trendelenburg sign, you can see here, it is produced when patient is asked to stand unassisted on one leg. Okay, when the person stands on one leg unassisted, the positive sign will show that there is a pelvic drop will occur on the unsupported leg. So this was the other side, the right leg was unsupported, and you saw that it was dropped. Now pelvic drop can be recognized by observing the level of iliac crest on both the right and left. If you compare, you can make out. So if the left gluteal muscles are weak, so if the left side is weak, then you know the right side of the pelvis will drop. If the left one weak, right side will drop. So let's see the previous one. So this side is dropped. So which side is weak? This side is weak, because these muscles are not able to compensate for the action that is being taken. Okay. The patient, when patient stands on their left leg and right leg is unsupported. So it is a vice versa. So you must remember, the left gluteal muscles are weak, the right side of the pelvis will drop, and vice versa. So this is called the Trendelenburg sign, and the opposite side, the shoulder will get lifted up. Okay. Thank you, Nilisha, and thanks for all your compliments. And very happy that you people are very interested and participating, and you are all answering great. And keep the interest going. Thank you so much for participating. With this, me signing off, Dr. Rohini, and watch me again at 9:30 for some more clinical based questions. That is at 9:30 p.m. See you at this time with more questions and more participants, and see you all